We're going to start with continuing coverage now of New York's overhaul of a Medicaid-funded program which allows people living with disabilities to choose their own care provider. Known as CDPAP, we have shared instances of concerns among users facing website issues, app complications, and more. Isabel Garcia has been following the troubled rollout to the single statewide administrator. She joins us now in studio with fresh insight from the governor's recent visit to Rochester. Izzy.
Yes, hi Adam. A quick refresher here. The big change was downsizing the 600+ fiscal intermediaries. These are companies which handle more administrative tasks such as payroll, down to just one, Public Partnerships LLC or PPL. Now the rollout to switch over to this company began on January 1st with the deadline of April 1st at the time to make the change. However, it's been an ongoing struggle for many. Through the CDPAP overhaul process, there have been rallies in Albany, legislation, litigation, and reports warning of potential fallouts to this happening in a 4-month time span with hundreds of thousands of users enrolled. The governor has repeatedly said this was needed due to fraud and waste, with costs ballooning upwards of $11 billion for 2025. Since the rollout opened up in January, there have been complaints of the website crashing, calls not being returned, app not working, among other issues. Georgia McCabe cares for her son, Brendan, who is legally blind, has cerebral palsy and epilepsy. She tells me her and the other 4 care team members wanted to wait until the end of January to switch over to PPL, thinking there may be some initial bugs or fixes to iron out at the onset. But then she discovered all of the information was already there.
All of a sudden, one day, I just got these email and text messages saying that everything had already been uploaded. And I'm like, I didn't do that. But basically, they had all the information for the personal assistants as well as my son. That included his Medicaid number, his name, his address, his Social Security, etc.
On Monday, during Governor Kathy Hochul's visit in Rochester regarding the state budget, I asked her why there is still such a commitment to having this overhaul continue to go through, given the ongoing concerns.
We've been talking about this for over a year. This is not an unexpected transition. It was passed in last year's budget. So an entire year has passed where we started telling people that this is going to happen. And your care will not be disrupted in the long term. A few hiccups early on were taken care of, but basically starting in January, people could transition. They had till April. Now it's May 15th. But I will also tell you this, and I hope your reporting will investigate this. There are individual companies who have refused to turn over the information about their patients for the transition to be successful. We were not able to reach them and tell them what was necessary because they were saying, despite the law in the state of New York, they're being obstinate and not sharing that information. So I think if you look at the cause for some of this disruption, it is at the hands of those who are intentionally trying to thwart our efforts to make sure we take care of our patients, but also stop this wild abuse of taxpayer dollars.
Great.
Now, that date the governor mentioned previously, May 15th, is due to a federal judge order requiring the home care transition deadline to be extended. The Department of Health also set up a hotline for folks seeking additional assistance with their concerns. That number will be posted with this article over on our website, rochesterfirst.com. For now, reporting in the studio, Isabel Garcia, News 8.